48,422. That's a pretty big number, isn't it? It describes an alarming problem in the United States that describes not just a number, but a body count. In 2024, 48,422 people in the US alone died as a result of contact with synthetic opioids, mainly fentanyl. Hey everyone, I'm Mick. Let's talk about something serious, but also a story of some truly brilliant science that's fighting back. We're going to dive into the fentanyl crisis and a potential game changer in how we detect it. Now first, it's key to know that fentanyl itself is a legal synthetic opiate designed for severe pain management, like in late-stage cancer treatment or major surgery. It's a vital tool in medicine when used under strict professional care. The extreme danger arises almost entirely from its illicit manufacture and abuse. Well, why is it considered such a dangerous drug? Well, we'll break it down into 3 parts. Number 1, its incredible potency. And this is a big one. Fentanyl is insanely powerful. To put it into perspective, it's estimated to be about 50 to 100 times more powerful than morphine and about 50 times more powerful than pharmaceutical-grade heroin. What this means is that an amount almost too small to see, literally a few grains of salt, about 2 milligrams, can be a lethal dose. This microscopic margin for error makes accidental overdoses terrifyingly easy. Number 2, the illicit manufacturing and mixing problem. Here's the thing, because it is so potent, it's very profitable for illegal drug producers. They use it to cut or mix with other drugs like heroin, cocaine, methamphetamine, and even make fake prescription pills that look identical to real ones like Xanax or oxycodone. And number 3, the speed and power of its effects. Fentanyl acts fast. It binds to the body's opioid receptors, which control pain and emotion, with incredible force. This rapidly overstems the brainstem, which controls breathing. An overdose causes respiratory depression, meaning that a person stops breathing. This can happen within minutes. The window to administer the overdose reversal drug naloxone or Narcan and get emergency help is very short. But why is it such a hard drug to stop? Drug producers are constantly creating new, slightly altered versions of fentanyl called analogs to circumvent laws and avoid detection. Over 1,400 of these analogs have been synthesized, some even more potent than fentanyl itself. These new compounds are designed to be invisible to current detection methods, which creates a massive challenge for regulation and public health officials. And as these structural modifications get even more complex, rapid screening becomes almost impossible. Now, the current method for finding unknown compounds uses tools like high-resolution mass spectrometry. But here's the problem. These methods rely on libraries of known chemical fingerprints. If a new fentanyl analog isn't in the library, it's like a ghost. It can slip right through. This is a huge problem because to truly understand the scope of abuse and toxicity, we need to comprehensively monitor not just the drugs, but their metabolites, the unique chemical traces they leave behind in our bodies and our environment. But what if we could teach a computer to hunt for these ghosts? That's exactly what a team of scientists from the Shanghai Institute for Doping Analysis and Fudan University have done. They've developed an insane machine learning platform called Fentanyl-Hunter, and it was just detailed in the paper Science Advances. This platform is designed to be rapid, accurate, and comprehensive, and it fundamentally outperforms previous models. And here's how it works. First, you have the smart filter. It uses a machine learning model called Fentanyl Finder. Think of it as a highly trained sniffer dog. Scientists trained it on 772 known fentanyl spectra, teaching it the fundamental scent of a fentanyl-like compound. It can now sift through massive amounts of mass spectrometry data from biological or environmental samples and flag anything that smells even remotely like a fentanyl. And then the Fentanyl ID tool takes over. This builds a huge multi-layer molecular network, basically a map of how compounds are related based on structural similarities. Even if a compound has never been seen before, this network can make a highly educated guess about its structure by comparing it to known neighbors on the map. The system covers over 87% of known fentanyl compounds. So as you can see, the workflow is brilliant and very comprehensive. The machine learning model finds the suspect compounds, and the molecular network helps identify exactly who or what they are. But does it work in the real world? Well, the results are pretty incredible. In tests on human liver cells, Fentanyl-Hunter identified 27 previously unknown metabolites from fentanyl compounds. Then, in real urine samples from users, it successfully detected metabolites, including 2 never-seen-before ones that matched their lab findings. But it goes even further. The team tested over 250 human samples from 8 different countries, from the US to China to Argentina, and found biomarkers of these opioids. They also looked at our environment, uncovering fentanyl and metabolites in wastewater, sewage, and sludge, and even seawater across these same 8 countries. They confirmed that norfentanyl is the dominant metabolite floating in our water systems, which is critical data. These results are very profound. This isn't just some kind of random lab experiment. This is a valid tool that's suggesting that the risks of fentanyl abuse and environmental pollution are even more widespread than we knew. And that's saying something because previous models like wastewater epidemiology already revealed this as a significant global problem, from national programs in Australia to pilot studies in US cities. But those traditional methods had a critical blind spot. They relied on the libraries of known compounds, causing dangerous new analogs to slip through undetected. This is precisely why Fentanyl-Hunter's ability to find the unknown analogs underscores the urgent need for smarter regulation. I mean, with this new predictive power provided by ML tools, regulators could finally implement true class-wide drug scheduling. This means defining the core chemical structure of a fentanyl analog and automatically banning any compound that fits the profile, even before it's synthesized on the street. Port of entry labs and mobile forensic units can be equipped with advanced MS systems integrated with platforms like Fentanyl-Hunter. This allows for rapid, on-the-spot identification of not just known drugs, but never-before-seen analogs, enabling faster seizures and more intelligent targeting of shipments. This moves the law from being reactive, always one step behind, to being genuinely proactive and predictive, finally matching the pace of the crisis. This allows for rapid, on-the-spot identification of not just known drugs, but never-before-seen analogs, enabling faster seizures and more intelligent targeting of shipments. This moves the law from being reactive, always one step behind, to being genuinely proactive and predictive, finally matching the pace of the crisis. This is where science meets solutions. It's a powerful reminder of how innovative thinking can tackle our biggest challenges. Challenges that we've been dealing with for centuries, or really since the first scientists asked their first questions. So what are your thoughts on using AI like this for public health? Let's talk about it down in the comments. Thank you for watching. Make sure you subscribe for more content. I'll see you in the next one.